Hey, good morning, everyone. You know, when it comes to our kids and our kids being sick, there's a lot of things out there that we can do for them, but there's so many mistakes when it comes to us giving them medicine.
Yeah, and a recent study just came out about kids and medicine, showing that there's an average of a medicine mistake happening in the home about once every 8 minutes across the country. So there's lots of ways that mistakes happen and lots of ways that we can help to protect kids.
Yeah.
One of the ways is that incorrect dosing. So if you remember when you were young, we just grabbed a teaspoon, and often the dosing says teaspoon,
right,
but it also talks about mils in liquid medication. So the best thing to do is get a syringe,
right,
or from your pharmacist, or a medicine cup, and measure it out accurately.
How long do these last? Because I have, like, just as long as you keep them
Yeah,
clean and wash them out?
clean them, wash them out,
Okay.
exactly. Another error that happens is double dosing or dosing too close together. Or
sometimes you're so alternate between Advil and Tylenol. And,
and that actually can cause dosing errors, sort of because
Okay.
you don't remember when you did it last, if mom did it, if dad did it, or
Right.
the caregiver, the babysitter. So you can just print out from a printable medication record,
Right.
or put a sticker right on the medication that reminds you, or there's even better, lots of apps that you can remind yourself when the last medication was taken, so you don't put, because you can cause liver damage with some things.
And we don't want to do that.
Yeah. So another thing is, actually, interestingly, the study showed that putting the medication in the wrong place. So a medication that should be oral is going in the wrong place,
right,
or that should be on the skin, the ears, the eyes, up the nose. There's lots of places. So
It's a chaotic lifestyle, right? And you're just trying to do your best.
So read the instructions really carefully. Make sure you know where
and
you're
ask
putting
your pharmacist
the
when you go to buy too. I guess.
Exactly. Another thing is taking the medications out, putting them in baggies, which of course is unsafe. It looks
Right.
like candies for kids, and then you don't have your expiry date anymore or your instructions on dosing. So don't take the labels off. Always put your medications back in the boxes. Don't mix them up and mix them together in bags, because that can be dangerous. Another thing is that, speaking of candy, this looks like candy. So
a lot of vitamins are like this now.
Yeah, and
the
don't
chewables.
tell your kids, take your candy, or I'm just going to give you some candy. Talk to your kids about medicine, that it is medicine, so you don't want them getting in there and thinking it's candy.
Right.
Another thing is to go through every sort of 3 to 6 months, set your alarm on your phone.
Right?
There's an expiry date, go through them, throw them out, or go to your pharmacist, even better, and ask them to dispose of them for you.
That looks like a bag at my house.
Yeah, and especially EpiPens, you want to make sure that you're up to date on that. So this is just a lockbox that you can get from an office supply store, but you really want to keep your medications up, out of sight, and locked. And even if they have to be in the fridge, get a really small lockbox, because this is how kids are getting into them. They're seeing them, they're interested, they're curious, and they're trying to keep them up high and locked. Another really common error that happens is that we often keep medications in our makeup bag, cosmetic bags in the bathroom. People have them in purses when you go to visit houses, and kids get into them in pockets of coats and so on. And so you really want to, again, just when you're going to somebody else's house or you have kids at your house, be really conscious about
also, when they go to the grandparents' house, they're a little bit,
and they may have things in boxes like this, and these are easy for kids to get into.
Okay, so we can find out more information, of course, online at Today's Parent. This is Dr. Joelene Huber. As well, I want to let you guys know that she's going to stick around. I want you to go to BT Extra. She's going to go join Winston. If you have other questions about your child's health and about what we just discussed, you can go on to BT Extra. Thank you very much.
Nice to see
You're going to get over there
Thanks
with
for
Winston.
having me.
We're going to take a break right now from Breakfast Television. Coming up, we'll talk about the heat and more in news.